I thank the Honourable Speaker. I now wish to invite the Honourable Ngcobo to address the House.
Somlomo, Mongameli, Nesekela Mongameli, namalunga ahloniphekileyo nezivakashi zethu. Sivela esikhathini lapho isimo sempilo besichema ngalendlela esabekayo. Besihlukene ngalendlela esabekayo. Bekunendawo zokwelapha ezibhalwe amagama abantu, ezikhetha abantu, nemabala abantu, nema ward abo ahlukene nama clinic abahlukene. Sivela kuleso simo ke esinjalo. Mr. President, you were correct when you made health one of the apex priorities among the others. Secondly, when you introduced national health insurance, which allows for equitable universal access and coverage as required by the Constitution, the Freedom Charter, and recommended by the World Health Organization. The alma mater during the 20th century had called for health for all by year 2000. The country is fulfilling that call now. Ama blocks ne-18 zokwakha ukuthi sikwazi ukuqala yona ke le national health insurance sezibekiwe nokuba zingagijimi zingasheshisi kodwa zikhona zibekiwe. Ukwakhiwa kwabusha kwezindawo zempilo, ukwakhiwa kwezibhedlela ezintsha namaklinikhi kuyindlela leyo eyitini zokwakhela i-national health insurance. Siyancoma ke ukuthi noma kuza kancane kodwa kuyenzeka ngoba ibhedlela lezongxiwankulu phela azisilungelanga thina esingebona ongxiwankulu. Ngakho ke sisifica sibandlululeka. Ukuze ke thina ke esiphofu sikwazi ukuzuza impilo lento ekuthiwa i-national health insurance izosisiza. The Green Paper on NHI was published in August 2011 for public comment. We are going to be awaiting the White Paper on NHI. Many people commented on the Green Paper. We were quite excited that there was a lot of talk on the national health insurance. In 2012, a bill on the establishment of the Office of Health Standards of Compliance was published. Public comments took place on the bill, and the bill was passed by the National Assembly in November 2012. However, there are some additions that come from the NCOP, and these will be taken care of. The Act calls for the establishment of the following units: the Inspectorate, the Ombud, and the Certification Office. Ngizothi ke kancane ngama pilot district ngokukhethwa uhulumeni. E-Eastern Cape kune OR Tambo. E-Free State kune Thabo Mofutsanyana. E-Gauteng kune Tshwane. KwaZulu Natal ngoba phela ibiyaziwa njenge epicenter of AIDS or of epidemic AIDS. Uhulumeni wakhetha uMzinyathi, wosukhetha uMzimkhulu. Kodwa isifundazwe sona uqobo lwaso sazifakela amajuba ngesimanga sokuthi sifuna ukuyisebenza kakhulu lento yengculazi ukuze abantu babe ngcono. eLimpopo iVembe i-district eyakhethwa. eMpumalanga iGert Sibanda. eNorthern Cape iPrixley Kaseme. eNorth West uDr Kenneth Kaunda. eWestern Cape kuse-Eden. Siyazi ke ukuthi njengoba sikhuluma ngalezi zifunda mningi umsebenzi osuwenziwe uxoxisana nabo bonke abantu abahlala kulezi indawo ezinalezi ifunda kuxoxiswane nemphakathi namakhosi nabezakhiwo zenkolo nezikole nokhansela nabo bonke akekho ongoxaxanga nayo ongathi akazi ngabe akalisho iqiniso. Mr. President, the national insurance will be rolled out from April to 2013 to 533 designated pilot clinics in the districts. 600 general practitioners have been registered to date to see the patients at the 10 clinics. There are more doctors that are committed, but because they're not registered, we will wait until they're registered to know their numbers. Various health personnel will be included to do the work to assist in the national health insurance. The community health workers, nurses that have retired, nurses that are in practice will assist in this. Further, Mr. President, you have announced that the fund for NHI will be available in the forthcoming year. This will allow for primary health care to take place within the designated districts. Mr. President, you have announced that the HIV and AIDS program in 2000, you have announced in 2009 that the HIV program, pregnant women had to start, were to be started and are being started on antiretroviral treatment should their CD4 count be 350 or less. And to start clinic within 14 weeks so that whatever diagnosis and other conditions that they have can be identified in good time and treatment, either than antiviral treatment be given. Prevention of mother-to-child transmission has declined from 8% in 2008 to 2.7% in 2011. There is a decline in mortality rates of infants and children before the age of 5. These estimates are reported by the MRC Medical Research Council. You also, Mr. President, encourage VCT campaign, and this has taken place. More than 13 million people have participated in this VCT, and those that came were predominantly women, unfortunately. And even now we're asking, what has happened to the male counterparts? Don't they experience HIV or AIDS in their lives that they do not come forward? But we are expecting men to come forward to be tested. And those that have been tested HIV positive from the group that came forward for testing have been started on antiretroviral treatment. Male medical circumcision has become an issue of the day. We are seeing young men en masse going for medical male circumcision, and we applaud this because as many men will become less vulnerable to HIV and AIDS provided they condomize after circumcision. And we are quite encouraged and excited that the monarch of the Zulus is supporting this activity by the young people. Mr. President, you are leading on the campaign on HIV and AIDS, and the Deputy President is the chairperson of SONA, plus the Minister of Health, who is also assisting in this. South Africa has the largest treatment program in the world, and World Health Organization is actually quite happy about this because South Africa seems to be turning the HIV and AIDS problem for the best. There have been reduction in the cost of antiretroviral drugs because the price of antiretroviral drugs have been reduced so that the country is able to buy more antiretroviral drugs, and the amount of funding that was to be given to those to the drugs for antiretroviral drugs are now used for those people who have been left out in the wagon of antiretroviral therapy. The industry has reported that there is a decline in the number of absenteeism at the workplace, and people are no longer sick as they were before interventions of antiretroviral drugs. Old Mutual has reported this. And life expectancy of individuals has been extended up to 61 years. This has been reported by the Medical Research Council. We have to start on family planning because as we speak, more young people are getting pregnant. Even nabantwana abafunda grade 7 sibafica bekhulelwe. Kungani kwenzeka lokhu? Ngiyacabanga ke ukuthi kwenza ukuthi phela sinalo umthetho we-choice of termination of pregnancy abawusebenzisa kabi ngoba umthetho wawo awuvimbi ukuthi abantu bakhulelwe. Usetshenziswa abantu masebekhulelwe, and kunezingqinamba zokuwusebenzisa awusetshenziswa noma kanjani. Mhlawumbe ubaba umphephetha uzosisiza lapha kule mpica abadala esinawo. Baba mphephetha, sinenkinga yamakolishi onesi avulwa engavulwi, aqalwa engaqalwa. Ngangamanje nje onesi ngisho onesi ke esibaziyo njengonesi abasaziyo isiguli sisekhaya sisembhedeni noma ngabe sikuphi esibhedlela, basaziwa bezazi bayimisele bayinikele. Sibaswele labo bonesi abenze njalo. Njengomphathiswa ke wezemfundo ephakeme nokuqeqesha, ngiyacabanga ukuthi wena ungenza lokho ukuthi kwenzeke, mhlambe ubambisene ke nongqongqoshe wezempilo. Siyethemba ngelinye ilanga ke sizowathola lamakolishi onesi aright, ngoba njenganje sinawo amakolishi ase-university afundisa onesi. Nami nje ngibafundisile onesi lapho, kodwa ababona ongqoshishilizi njengonesi abafundiswe emakolishi. Futhi siyazi ukuthi kunalamakolishi lawa awoqhibukhowe abiza ngalendlela emangalisayo, athi ebiza enjalo nje abe esikhiqizela amanesi angekho esimeni esikahle ngokwezidingo zanamhlanje. Baba mphephetha, ngiyethemba ke leso simo uzosibheka usheshise futhi ukusibhekela ngoba phela sisenkingeni siyi-South Africa. Siphinde futhi sikhulume ngama-university. Baba mphephetha, ama-university uma sixoxisana namanye awo singumnyango wezempilo athi ubukhulu bawo busenjengoba bunjalo kudala ngaphambi ka-1994. Manje awakwazi ukuthatha odokotela abadlula inombolo leyo akade beyithatha ngo-1994. Kepha-ke umhlolo ukuthi i-vets ibathathile odokotela abawu-40 ukuthi yona inwebe kanjani-ke. Kodwa-ke mhlawumbe mphephetho ngeso lakho elikhulu ungakwazi ukubhekisisa ukuthi mhlawumbe ama-university anweba kanjani ukuze kukwazi ukuthi sithole odokotela abaningana kunalaba abakhona. On that note, we will meet President. We are quite excited that some of the departments have taken the young people, trained them so that they are able to assist in the primary health care as well as in the implementation of the national health insurance. So we are hoping that with time,
Honourable Member, your time has expired.
HIV will be done. And I thank you, Honorable Speaker.
Thank you, Honourable Member.